You are listening to Drive. We are here every weekday afternoon from 3:30 to 6:30. Now, it really does seem like another day, another fire at a tobacco shop. And today, police are investigating a fire and a ram raid at 2 tobacco stores in Ballarat. That's the third in the town in recent weeks. And of course, we've got Task Force Luna. We've spoken to the police about that in the past. It's a specialist unit. And police have made some arrests, but still the attacks continue. Now, one of the state's best-known criminal barristers has stepped into the conversation around illegal tobacco because he says that the networks involved in illegal tobacco have pivoted to vapes. Robert Richter says Australia's prohibitionist stance on vaping is a case study in how not to handle a public health challenge. Robert Richter, welcome to Drive.
Thank you. Happy to be here.
Why get involved in this debate?
Well, because I'm a vapor. I was a nicotine addict for many years and remain a nicotine user. But I stopped smoking 5 years ago when I had a lung cancer removed, and it was very fortunately detected by accident and removed, which means that I was told I didn't need any further treatment, but I could continue my practice and continue to work, providing I didn't smoke. And when I spoke to the surgeon, and I said, if I don't smoke, I can't work, because I can't concentrate when I'm working late at night, when I'm reading, etc., etc. This happens to people who are habituated into smoking. And he said that I could opt for vaping nicotine because it was at least 95% safer than smoking cigarettes. And that's what I did.
So what's wrong with the federal government's prescription-only policy on vapes? You can always go to your GP, get a prescription.
It's rubbish. It's complete and absolute rubbish. The fact is, I have a prescription. I can't fill it anywhere. The fact is that the kind of prohibitionist approach requires prescription to medicalise it, whereas people who are addicted to cigarettes are able to go out and buy cigarettes anytime they want. They don't need prescriptions. They don't need anything. This is insanity. It is the craziest thing that you come across, and is the obvious thing that happens with prohibition-type setups. You go and look at what New Zealand is doing, and you say to yourself, this is actually working. It's getting people off cigarettes, and even if it means that they vape nicotine, that's not going to hurt their lungs in the same way.
So I'll ask you about New Zealand in a tick, but your sense now is that the illegal tobacco trade has simply become an illegal vape trade that has just pushed everything underground?
Well, that's happening. That is happening, and we know that there are a lot of imported, especially throwaway vapes, e-cigarettes types, disposables, are being smuggled at enormous rates and are selling at huge profits. Now, any time you create that kind of a market by a regulatory system, you're bound to create a system whereby people will struggle for territory and profit. And this is what happens with vapes, as it has happened with cigarette tobacco. Tobacco imports, smuggled tobacco, has the same sort of issues in terms of territory, and they go together hand in hand.
So how do you, the New Zealand example, how do you regulate it in a way that doesn't push it underground, but also, and this is, often what is used as the reason for needing way tighter restrictions, also prevents kids vaping?
How about regulating it in the same way that you regulate cigarette purchases, which are damaging and will kill you in the end, or may kill you in the end, or if you're lucky, you'll survive to a ripe old age as a cigarette smoker. But why isn't that regulated? It's regulated by saying that people under 18 are not allowed to buy cigarettes. But you go around and you see the kids who start smoking cigarettes, they're not listening to the under 18 ban, and they're getting their cigarettes elsewhere. Now, if it's all right for cigarettes, why isn't it all right for vapes, which are less damaging, 95% less damaging to the lungs? And this is the absurdity of the kind of prohibitionist model. It's not entirely prohibited because, of course, it requires a prescription. But this is inequitable. It requires the poorest people, who are the most exposed to cigarette addiction, to go and see a doctor and pay for the doctor, and to go and try and fill prescriptions and pay for the chemist and the pharmacist and so on. It's an absurd situation.
And Robert Richter, when you look at somewhere like New Zealand, though, do they have the same problem with illegal groups controlling the trade? What's the situation?
No, they don't, because they don't have the same sort of regulation. I mean, people who sell vapes and so on, they're licensed. I mean, they have to be registered and the like. But the figures that we have recently obtained from New Zealand indicate that whilst there has been an increase in vaping, there has been an equivalent diminution in the number of people who smoke cigarettes. And this is most emphatically the case for women and for the poor. The fact that if you're a cigarette addict, the cost of buying cigarettes is enormous compared to vaping nicotine, which will at least give you the same relief when you're craving nicotine.
Well, Robert Richter, it's interesting. It's not every day that you get a criminal barrister entering that debate. So thank you for joining us. It's interesting thoughts.
My pleasure. Whenever we have a prohibitionist regime, I'll be there to say it's intended to create an underworld war.
Robert Richter, thank you. Robert Richter there, he's a criminal defence barrister. I wonder what you think. Is it that all we're doing is pushing vapes underground? We know what's happening in the tobacco space. As I said, it's almost like another day, another fire, and a lot of those tobacco shops have or had pivoted to selling vapes as well. Increasingly, the laws around vapes are getting tighter and tighter. So are we simply pushing it underground? Is it better to regulate it? Can you have effective border control? The sheer volume of product that comes into the country, is there any way that you can actually effectively regulate that? 1300 222 774 is the number.